Hi, this is Southampton Town Supervisor Jay Schneiderman, and welcome to Talk of the Town, where we take a close look at issues facing our community. Today, we're going to be talking about the coronavirus and how law enforcement, code enforcement, and public safety functions are responding to the pandemic. I'm taping this show virtually, so I am not in the studios. So much of life has changed. So many functions have changed. We're doing so many things differently, and this is the first time we're taping via a teleconference. And I'm joined today by the head of our police department, Chief Stephen Skrinicki, and also by Ryan Murphy, the head of our public safety division, which includes ordinance enforcement. Welcome to you both.
Thank you.
So let's start with you, Chief. The police department has gone through many changes. The last time I talked with you was about a month ago. It seems like a year ago in terms of having you on this show. We talk almost every day on the phone. The police department has been tasked with many things, from trying to enforce quarantines to enforcing social distancing and non-essential businesses and all of the executive orders that have come out of New York State through Andrew Cuomo's office. Can you bring us a little bit up to speed in terms of the town's response to the coronavirus pandemic and how that's affecting the police department?
Well, as we spoke about the last time we were on your show, our first and primary concern is to try to keep our membership safe and healthy. If we're not safe and healthy, then we can't help the public. So we've been doing a great job with that. I'm very proud of the men and women and the safety precautions that we've provided for them in terms of equipment and personal protective equipment, and the fact that they're utilizing that equipment and they're engaging in good safety practices on and off duty. So as of today, we have one confirmed detective and we have one confirmed court officer. We've had an influx of exposures where we've had members of the force out for periods of time, monitoring them. They've all come back with the exception of the two that I just mentioned. So,
when you say confirmed, these are positive for coronavirus?
That is correct. Yes. I mean, our men and women are on the front line, so we do have exposures, and they do occur. But I think for a force of our size, to have only two individuals confirmed and not infecting other people in the department is a success for us with our first mission, which is keep ourselves safe.
Can I ask how they're doing health-wise?
Yeah, they're doing well. Both are at home, recovering at home, and they don't require any hospitalization, thank God. Their symptoms vary from day to day. We're in touch with them constantly, making sure that they get what they need, but they are doing well, and we do expect full recovery. Yes. Now, on the other side of the coin, what we're doing for the public is vast. We're complying and trying to enforce all of the recent executive orders coming from the governor's office. As you know, they've been changing almost on a weekly, if not sometimes daily basis. In fact, one that just came across our desk yesterday, which will go into effect tomorrow night at 8 p.m., that's on the 15th, is very significant, which will require people who are working in essential businesses who have direct contact with the public to wear a mask. And the burden will be placed on the employer to make sure that they're providing those masks. And as we get to this point in time, managing the virus, I think it's very critical for all of our residents and our essential business people to really be at the height of their guard right now. You and I have been discussing and watching the migration of the virus from west to east. It seems like we are at a pinnacle point right now, hoping to turn that curve. And I think it's very important that everybody oblige these regulations right now. So we are out visiting businesses. We're looking for that compliance, and we're getting the compliance. We have a three-step program here for compliance to that. The first step being inform and warn. And so far, we have not had to take any enforcement action beyond that. We would have two phases of enforcement action if necessary beyond that. but so far, all of our business people, all of our residents who might be uninformed or for some reason just lax, when we point out that they're doing something that needs to be corrected, they've all been compliant. So we're grateful for that. We think that that is helping our situation, and we know that everyone in this township has a critical role to play if we want to get through this with the least amount of complications and hardships as possible.
Okay, let's go over some of those rules that are in place that you're tasked with enforcing. So you mentioned non-essential businesses, and there's lots of them. Home construction being one of them, unless it's a single person at a site. There's also social distancing, which is people are supposed to stay 6 feet, if I understand it correctly, from other people. There's also a prohibition of gatherings of any sort. And then there's several categories of quarantining. Anyone who's tested positive is supposed to be at home for a 14-day period, and anyone in close contact is also supposed to be in a mandatory quarantine. Are you attempting to enforce all of those provisions?
Well, we've been sharing that responsibility with code enforcement. Ryan Murphy, who's on the show today as well, he and I have been in very close contact. We're almost daily talking about how we're going to manage that. So certain tasks, mostly related to construction sites and construction work, has been passed over to code enforcement, which traditionally manages that type of activity. The retail essential businesses and how they are operating has been falling more towards the police department. But both of us will bring in other agencies as well when necessary. For example, Ryan might bring in building inspectors. I might bring in fire marshals if we're looking at an essential business that is not mindful of the reduction of crowds that need to be in the essential business. Or I might bring in the state liquor authority if there's a restaurant which is permitted now to serve and manage takeout food, but is not supposed to be serving drinks at a bar while customers are waiting for their takeout food. So between Ryan and I, we are taking the lion's share of monitoring and potentially enforcing this, but both of us rely on other departments within the town and within local and state government to assist us.
All right, well, let's go to you, Ryan. Ryan Murphy is our Public Safety Director, also Head of Ordinance Enforcement. So Ryan, let's talk a little bit about your role and how you've been responding to the coronavirus pandemic and how you've been attempting to enforce some of these restrictions.
Sure. As the chief mentioned, we work together on a very regular basis. It's been a good partnership through this entire event so far because of the way that our different staff members between his police officers and my code officers have to interact out in the field. It's different levels of enforcement. It's different, types, but all of it has to kind of be coordinated together. And we've been doing that and having regular, calls and meetings since day one to try and make sure that that's accomplished. The code enforcement side of things, as was mentioned, a lot of the code enforcement officers are out there dealing with the construction aspects of things, any non-essential construction, as well as some of the landscaping calls that we receive for what people either believe to be or perceive to be non-essential landscaping. And a lot of the issues that I think we've all been dealing with since the beginning of this is the chief mentioned. This is a very evolving and ongoing situation. We've had changes to these rules where to give you an example, golf courses. Thursday morning last week, golf courses were permitted still to operate. By Thursday afternoon, we had received a change to the executive order and the guidance associated with the executive order that had then said that golf courses were now considered to be non-essential. So it changes weekly. Sometimes it changes daily. Sometimes it changes in the middle of the day. And all of the officers, whether it's the code enforcement staff or the police officers, have to constantly be out there trying to make sure that the public and the businesses are all following these different changes that occur to the executive orders. And thankfully, the residents of the town and the businesses have been very receptive to it. As confusing as it's been, as evolving as it's been, we understand the impact that it's having on people's livelihoods and also just their regular lives, their ability to go about their business as usual. And we definitely appreciate the patience of the residents as we have to deliver this news to them of these changes, which are, not necessarily being implemented by us, but the enforcement of the changes and the orders is being carried out by us. In a lot of cases, too, with regards to, construction and any kind of non-essential activities, sometimes the code enforcement acts as the first point of contact with the individuals that are out there, to inform and warn them the same way that the police department is. And then if it has to, which thankfully so far it has not had to be escalated to a real enforcement activity where a ticket has to be issued, for example, a lot of that would fall under the penal code and would then get passed off and handed off to the police department to carry out that action if necessary. So it's a combined effort, and if my code enforcement staff is out there on say a construction site and they meet any kind of resistance, immediately they know that the police department is there to back them up, and they can call them and they'll be there right away to help deliver that message and make sure that the people are coming into compliance as they should be. So it's been a very good and combined effort so far.
Ryan, some of the towns have closed their parks. I've kept our parks open. You're feeling that, the beaches are a good place to social distance and people need to get some exercise. Have you found that to be a problem, the parks, or either, you or Chief Skrnicki, are there issues with people not social distancing in various places, including town parks?
We haven't, I would defer to the chief a little bit on this. I haven't heard of any real problems. I had some conversations with the Bay constables, one of them the other day, that said that, some of these pictures that we're seeing on like social media from the public of crowded roadways near Ocean Beach and stuff like that, or Ocean Road, rather. It's more of a crowded roadway. And then once the people get out onto the beach, they've been kind of spreading out and for the most part, following the rules. They've had to speak to some people, but Chief, are you hearing any real issues with the parks and the beaches so far?
Yeah, we have received a few complaints. Sometimes it's a misinterpretation. You might see 6 people sitting on the beach 2 feet apart from one another, but those 6 people may be cohabitants of a residence. And if they are, they're not violating any of the guidelines because they're cohabitating and they're in touch and in contact with each other on a daily basis. So the image of 6 people in a cluster might initially appear to be in violation, and some people are calling us, and we send an officer down to investigate that. And if we find that that's the case, we're fine with that. All in all, and the vast majority of people, Supervisor, that are frequenting our parks or beaches, they are cognizant of the social distancing requirement, and they're following that. I really would have to praise our township and the members in the residents in our township for cooperating and being aware of the importance of cooperating, that each one of them actually has a very important role here. And I think they recognize that, and I would encourage them to continue recognizing that.
Chief, have you had direct contact, any of your men or women, with somebody who's tested positive, like an arrest or a situation where you had to go into a home that may had somebody positive? And what special precautions or cleaning procedures do you use in an event like that?
Yes, that is probably the most complicated thing for us to manage right now, is a situation where somebody is doing something wrong, has to be arrested, and that individual has the virus. And we have had 2 situations like that in recent time. First one, where the individual required some medical attention at the hospital, and the hospital advised us that the person seemed to be COVID-19 positive. So we do have Tyvek suits. Our officers have gloves to wear. Our officers all have N95 masks and facial shields. So if they are donning all of that protective equipment, they can manage an individual under those circumstances safely and have little or no concern about catching the virus themselves. So we've done that. The second episode just last week was even more complicated in that we had a very a violent individual, uncooperative at the time of arrest, who needed to be tased to be brought under control. And in that situation, we were in the interior of the residence. So now, you know, you're inside a residence where a person has the virus, surfaces can be contaminated, and officers are acting, and you know, you have to remember that our work as police officers remains as it is. Sometimes we're in situations where officers can be in harm's way. This was a situation like that. And when an officer is in harm's way, first and foremost in their mind may not be their personal protection of the virus. They're more concerned with the potential for physical violence and controlling that environment as they normally do. So we did have a little bit of a slip up there. It's to some degree understandable. Officers are under a lot of stress in a situation like that. And we do have 2 officers who are out right now, not testing positive, but being monitored as a result of that situation.
So Ryan, the chief mentioned personal protective equipment, PPE. That's the term we're all getting used to these days. I know you've been involved with trying to secure PPE for various entities, including the Shinnecock Reservation and the hospitals. Can you talk a little bit about the challenges in acquiring those things and what your role has been in terms of logistics and supplies through this epidemic?
Yeah, sure. It's definitely been a unique situation. There has been a tremendous shortage. I think globally there's been a big shortage of particular pieces of PPE, masks, N95 masks, surgical masks. Some of the chief mentioned he has some Tyvek suits that the officers can use. You know, even Tyvek suits are in short supply nowadays. There are a lot of other different pieces of equipment that are hard to come by. We've been working with the county and the state to try and acquire as much of the supplies as we can. Also included in that would be like sanitizing supplies, hand sanitizer in particular, and some of the other different chemical agents that can neutralize the virus or kill off the virus. Some of those types of cleaning supplies have been a little tough to come by. We've been working with the county and the state. We've been able to get our hands on some supply of that. I think we went into the beginning of the disaster, the beginning of the COVID-19 crisis, with a decent amount of supplies to be able to get us rolling. But we've hit a point now, I think, where we're definitely experiencing some supply shortages, because as the virus continues to spread throughout the United States, there are more and more communities, more and more states that are all drawing down off of the same system. And so this competition for resources that exists out there has been a bit problematic. And we see that even with the healthcare network, with the hospitals, where they're experiencing shortages for, you know, things like protective gowns. So we've been working with folks in employee safety and the comptroller's office here to try and vet some of the different vendors that are out there. As normally occurs with disaster situations, you get a lot of solicitations from vendors where they're approaching, saying that they can provide supplies, they have supplies available to them. This is not uncommon, but we have to try and make sure that those are legitimate suppliers. We also have to look at the cost factors and at what point the supplies will arrive to us. A lot of these people are talking about supplies that are coming over potentially on cargo ships from places like China, where the supply arrival is, you know, 4 to 6 weeks out. And right now we're in the heat of this and we really need these things now. So we just recently put in an order And we're keeping our fingers crossed. We've done some research on it, and we're keeping our fingers crossed anyway as to the success of the orders. So hopefully we'll have 10,000 more surgical masks coming towards the town with an expected delivery date of next week. We also just received a call moments before we got on this conference from the county to release some more supplies to us. I'm not sure whether those are supplies that are being directed towards the town itself, or whether it's the supplies that we've requested as additional for the Shinnecock Nation, because we have been putting in supply requests for them. So far, we've delivered N95 masks, surgical masks, gloves, and hand sanitizer to the Shinnecock Nation to support their feeding efforts, as well as their health clinic efforts on the Nation property there.
Now, my conversation with the hospital this week seemed like they were managing the number of cases fairly well, in terms of they still had beds available, they still had ventilators available. But there has been a concern about the number of people in our area, that our population has surged. A lot of New York City people who normally wouldn't be out here this time of year, they own properties out here, enjoy their summer homes during the summer season, have come out to spend the time here during this pandemic rather than in the city. Chief, is that your experience? Do we have any idea how many people are out here right now?
It's pretty hard to know exactly how much our population has grown, but there is no question about it. We see residents that are typically this time of the year unoccupied, occupied. So most people, it seems, that have a second home out here are utilizing that right now. And as you know, in the summer months, our population can double, sometimes triple on a weekend. I don't think it's at a triple state, but certainly there is a significant addition to our normal population at this time of year. And I think you are correct that some of those individuals came out with the virus within their family and possibly spread it a little bit more since they've been here. I think we're settling down a little bit now, because I think that migration out to our township is pretty much over now. So whatever did come out is here. And as you know, this virus seems to have, with a relatively healthy individual who can combat this on their own, usually has about a 2-week lifespan. So, if we look back and say it seemed that our population really grew maybe three weeks ago, we should be at a point now where if people had the virus when they came here and they quarantined as they were requested to, that should be starting to slow down. And our numbers are starting to reflect that.
Well, the incident rate across the town is interesting. Some of the highest incidence is in areas that don't have a lot of summer homeowners. Let me see if I can share a screen here, and let's see if the viewers can see this. But this is a map that is put out, and it's going to be a little bit hard for me to focus. Townwide, you can see Southampton has 319 cases at the moment, and the different colors indicate different concentrations. This is the Hampton Bays community with 71 cases. And it also, if I click on it, you can see the rate per 1,000. So 4.97 cases per 1,000. Some of the other areas, Tuckahoe has 17, but a much higher rate per 1,000. Southampton Village, 29. And there's pretty much cases, sorry for going out so far here. My computer's a little bit too sensitive. Riverside 10, Northampton 3, West Hampton 23, 5 Remsenburg, East Quad 20. There's very few places that don't have any. Even Shinnecock Reservation now has one that's shown. Sagaponack only 1. Noyak is up to 20. Sag Harbor 2. Pretty spread out. It's hard to say that the influx of New York City metropolitan area residents have led to a dramatic increase. it seems to be hitting minority communities harder than other areas. Flanders with 47, Hampton Bays with 71. And now it's possible because there's more people per house, um, more densely populated areas. Um, it could be the South Fork, now 319 versus Southampton, and Southampton is 319. Southold is 239. For a long time, Southold had more cases than Southampton. That seems to have changed. We've shot up a bit. I'm not exactly sure. Maybe that is a function of all the people who came out here. But it's that map is available to anyone who wants to see it. If they go to the county's website, just Google Suffolk County, and then there's COVID-19 updates, and then they'll click on that. It's in the top left, and then there's a link for the map, and anybody can view that map, and you can look at a hamlet by hamlet breakdown, or you can look at a town by town breakdown. And we've been watching this. I know all of you guys have been looking at these numbers, waiting for us to hit that apex. Chief, are we close to the apex, do you think?
I certainly like to hope so. And I do think we are. But as you pointed out, just from yesterday to today, there's an increase of about a dozen more cases. And there's no question about it. In the more densely populated areas that you just mentioned, Hampton Bays and Flanders, for example, we are seeing the majority of our cases. So in those areas in particular, we need to be very diligent. We need to be very mindful of how this virus spreads and take the precautions that have been recommended to us by the state. And again, our residents are very much in compliance, but this is, I think, a critical point in time to not let our guard down. I have a little bit of concern that as you hear other places in the state reporting that they're improving, if you look at the migration, and we're aware that it seemed to migrate from west to east and from upstate and Westchester down to where we are, we were at the back end of that migration. So it's logical that we're going to be a little bit delayed in coming out of this as well. And I hope that our residents are not looking at the news and saying, oh, it looks like the coast is clear now and we can drop our guard. I think this is a critical time to keep our guard up. Next couple of weeks, I think, will be very, very important to us. And hopefully after another couple of weeks, we'll start to see the same downward trend that some of the other communities upstate are seeing now.
So the state restrictions are many, but one of the things that I had asked the governor to consider was putting some travel restrictions on non-essential visits to the area, short-term visits, leisure visits, sightseeing visits, those kinds of things. I wrote a letter that got signed by several other supervisors and mayors, and the governor did not put in those types of restrictions. I've been concerned that if you have new people constantly coming into the community, not necessarily a homeowner who's staying for several weeks or a month, but somebody just coming out for 3 or 4 days to stay in a house or to just enjoy our area, that really is unnecessary, and all it does is increase our risk factor. We didn't get that restriction from the state, but I've been working with Ryan on enforcing a provision we already have in the town code where a home can't be rented for less than 2 weeks. And during this special period to the end of April, corresponding to the governor's most recent order, we have put in place an effort, sort of a surge, to try to identify some of these short-term property rentals. Ryan, can you talk a little bit about that and how we're going about trying to limit the short-term use of properties?
Yes, sure. So as you stated, Supervisor, we've launched that crackdown. The code enforcement staff is actively monitoring the variety of different sites that are out there for short-term rentals, things like Airbnb, VRBO, out east, and checking those sites to identify properties that are currently listed for stays that are less than the allowable stay according to the code, which is the 2-week minimum. If properties are identified on the sites, if we can do a positive match of the property versus some of the data that we have in our GIS system, we're matching them up. If not, the officers are going out into the field in the areas that most of those sites have the property roughly matched to a location on a map. So we can narrow it down. Once they get a corresponding address, the notices of violation are being sent out to the property owners to inform them of the action and violation of the code. The property owner at that point would have to do one of two things. They either need to pull the rental down altogether, or they would need to change the rental to reflect at least the 2-week minimum stay, which would be an indicator that the person that's coming out is not just coming out for necessarily a leisure visit to the community, and potentially someone that we should be concerned might bring the virus out with them. That's somebody that would be staying for a while, and they would need to secure a valid rental permit. So the officers are out there. That's kind of become on top of enforcing some of the other aspects of the executive orders. This has become a forefront mission of the code enforcement staff at this point in time. We've already seen 1 or 2 properties that have amended their listing on Airbnb to reflect a 13-night minimum so that they are in compliance with the code. In one case, it was a property that has a valid rental permit already. They just weren't adhering to the transient stay restrictions. So they've amended their listing to reflect at least the 13-night minimum, 14-day minimum requirement. So we are out there actively investigating those and following up on them right now.
Chief, let me ask you about crime in general. We talked about the population increase, and I know you're busy with all these state restrictions, but what about general crimes? Have we seen that decrease or increase, or it's not a lot of crazy parties these days, right? There's no parties at all. So are you seeing any changes in the regular day-to-day crimes that you normally would see?
Yeah, we are actually. The good news is in general, crime is down right now. So our crime stats seem to be diminishing. The concern we have are in 2 areas predominantly. One, businesses and business burglaries. Businesses are closed down. They're not occupied. So our officers have been directed and are following our direction to be very diligent and patrol businesses that are currently not doing business, particularly during the nighttime hours. I mean, you can just imagine the hardship of somebody who is already not able to do business because they're not essential, and the additional hardship if that structure was burglarized and some of their inventory was stolen. So we're very mindful that is a potential and would be really a tremendous hardship on the business owner. So we're concentrating on that. We are seeing an uptick, as you might expect, in some domestic issues. People are at home a lot more than they usually are. Spouses are maybe not used to spending so much time together, and kids are not in the household as frequently. So we are getting an uptick in some domestic disturbances. Thank goodness none have been really super out of control, but we definitely are seeing an increase in that kind of call. And we're getting an awful lot of inquiries, as Ryan mentioned before, with people just trying to understand what they can and cannot do. The guidelines are constantly changing. Right now, a hot topic and one that, quite frankly, is still gray, and we're still trying to work our way through it, is how all of the current executive orders affect marinas and operations within marinas and the waterways. So our bay constables, we met with our bay constables yesterday, spoke for about an hour and a half, giving them direction, interpreting the orders the best we can, and realizing that there are some conflicts that perhaps still need to be worked out. with the governor's office. So some of that will be pushed back, as we have done with some of the orders that have come out that seem to present the conflict, for some clarification and maybe more modification.
I know sometimes crime stats are related to economic stats as people struggle. I guess it's become more likely that they'll do what they need to put food on the table, and sometimes that leads to burglaries and things like that. I know you've seen the unemployment numbers have shot through the roof. The food pantries are reporting a quadrupling of the number of people coming to get food. The economics of this are going to be devastating. So many people are out of work. Do you foresee that may create some challenges later on in this for for your department in terms of enforcing the laws?
Everything you just said is historically been correct. When we look at an economic downturn, we generally will see crimes that are committed, because people are at a state of desperation. We're not really seeing that now, and maybe some of that is because we're kind of new into this situation, and people have some reserves that they're relying on, and there has been some government assistance. So currently, we're not seeing that, but you are 100% correct, and we are mindful of that and a potential that could change. So again, we're starting to see right now a little, just in the last couple of days actually, a little uptick in break-ins to cars. So we've sent a message out to the public repeatedly that I think is worth repeating right now, and that is secure your property. Be mindful that most break-ins, and people call them break-ins, but generally they're just entries to vehicles. In most cases, those vehicles are unlocked, unsecured, and frequently have objects of value in plain sight. So I can't overemphasize the idea of removing valuables from plain sight in a vehicle and lock your vehicle, even when it's in your driveway or on your property. There are people who will be cruising around at night looking for that opportunity. Don't provide the opportunity. And we do see, when people secure their property, a reluctance on the part of the individual who wants that property to actually break in. So the best thing residents can do to guard against that potential is make sure your house is secure, your car is secure. Don't leave valuables around. We had a recent, and this is not happening right now, which is helping our crime rate. Very recently, we had an uptick in larcenies from job sites. A lot of our construction workers come out here and leave very valuable construction equipment on the site overnight. And a few people became aware of that, coming from the West, came out here and were helping themselves to very expensive construction equipment. We were able to, that was a ring of people, we were able to identify them and arrest them. We did search warrants in a house, and the house looked like Home Depot. Inside the house, there were so many expensive tools. So again, this is all about securing your property.
All right, so let's go to you, Ryan. Just in terms of how people can help protect themselves and others in this period, any words of advice? What should the Southampton town resident be doing right now to do their part to prevent coronavirus spread?
I think you guys both kind of hit it on the head earlier when you delivered the message of not becoming complacent in this entire effort, and not watching the news and seeing that we're starting to see some plateauing or some falling off of the cases in different places, and reacting inappropriately to that and saying, well, I guess the coast is clear, we can go back to normal. It's really important for the residents to understand that even once we do hit a plateau, even once we hit that apex, which hopefully we're all hoping that we're at that point, and the hospital system seems to be looking like starting to plateau a little bit, but we're still seeing an increase in the number of confirmed cases out there. So that number's not dropping. The hospital system, which we've always been very concerned about since the beginning, becoming inundated, seems to be leveling off a little bit, but it's a little too soon to tell. The important thing for the residents, all of our residents, to remember is that even once we get to that point, it's not going to fall off immediately. We can't just go back to normal immediately. As much as we all would like to, that's not the prudent thing. That's not the smart thing for us to do at that point. We have to continue to act in a precautionary way so that it gives the virus the chance to continue to fall off the way we want it to. If we just open the floodgates and everything returns to normal, as soon as we start to level off, what we'll probably see is another spike again. We'll see an increase to go along with that because we are going to too rapidly return to normal. So we need people to maintain an understanding of the need. We might not like it, and none of us like the place that we're in right now in terms of the restrictions that have to be out there. But these restrictions are there for a reason. And as much as we don't like them, we have to understand the need for those restrictions to maybe linger a little while once we've hit that plateau, to give this a chance to continue to fall off the way we want it to. So I think that people need to understand that. And then I think people need to continue to act in accordance with that understanding. Maintain their social distancing. Be prepared to continue to maintain that for a little while. Be prepared to continue to not be able to gather en masse to prevent this continued spread of this virus. Because remember, the cases are still going up. Even if hospitalization is plateauing a little bit, the cases are still on the rise. And there's also, everybody needs to understand that, you know, we still do have, although we have an increase in testing, there still is a limited amount of testing availability. So there is a great likelihood that there are more cases out there, and people that are asymptomatic, that aren't demonstrating any of the cough and fever and respiratory distress symptoms, or maybe all they have is a cough, but they haven't hit the fever mark. So there's probably more of that out there, which is why I think the chief would agree. Any of our folks that are out there in the field, any of our personnel, are basically at the point where we have to treat any people that we come in contact with and any households that we have to enter as if it's a positive household, because of testing, limitations that still exist to a degree, as well as people that are asymptomatic that don't even realize that they have it and would have no reason to even go and get tested. So we need the population, we need the residents in the community to understand all of that, understand that it's going to take some time for the fall off to occur, maintain the social distancing. There's the new order that the chief mentioned from the governor's office that, employers of essential business workers that have to interact with the public are now going to have to be provided with masks. But members of the general public, residents that are out there, cloth face masks aren't a bad option when you know that you're going to be in a situation where you might have to get a little bit closer than you'd like to people, whether it's, out at the supermarket or whatever it happens to be. It's not a bad option. The best option is to maintain the social distancing. The other best tactics to try and continue to fight this are the same things that we've been preaching from the beginning, which is frequent hand washing, maintaining respiratory hygiene by covering coughs, sneezes. Those are all great strategies, and we need to continue to employ those strategies even when we start to see those numbers fall off a little bit, because the only way they're going to keep falling is if we maintain those strategies.
Now, we do have some testing facilities operational on the East End besides the hospital. So there's two in Riverhead now, yes. One by Pro Health, I think it's called, and one that the county set up through the Hudson River Health Clinic. So at least there's that capacity now. There's more testing, probably still not nearly enough, but that's good. And in terms of helping people stay at home, the town launched a program called ASAP, All Seniors Assistance Program, and people can take advantage of that. If you're over 60 years old, you can call 631-702-1777. or go online to the town's webpage and click the ASAP link at the top left and enroll in the program. We will deliver free of charge essentials. You just have to order it from the participating merchants, pay by credit card, and we will come and pick it up and deliver it for you. So that's been a successful program. I think there's over 1,500 seniors now participating. That's exciting, and other towns have followed the same formula, East Hampton and Riverhead, and I hear other towns are going to go start doing it as well. That's good. So let me just end. Chief, is there anything else you want to say to our viewers in terms of what they can do to stay safe and help do their part in preventing the spread of the virus?
I think it's very important. Ryan kind of summed up all of the personal things that an individual can do, but it's very important to realize that we all have a critical role. Even the individual who is staying home right now, who may feel kind of out of it and feel like, I'm really not contributing. You are contributing. You're contributing quite a bit, as a matter of fact. So it's important for everybody to realize that this social distancing right now, as we hopefully approach the pinnacle or are at the pinnacle, is a critical issue. And I would like to also just compliment our businesses, our essential businesses, which we are going around and visiting, pointing out to them where they might be a little bit, off of the recommendations that are coming down from Albany, are complying, adhering to these policies. We actually have a poster now. I'll maybe show if it can show up here. That's hanging in the window of a lot of our businesses that we visit, that acknowledges the fact that they're working with the town police department and the town government to be compliant, and it reminds patrons of the business to social distance while they're inside, which is very, very important. And I would probably add just one other thing. Remember that if you're purchasing something now, or even if you're getting mail to your house, just as Ryan mentioned, we're out in the field now. Our officers consider every individual as possibly having the virus. You should look at anything coming into your household the same way. So if you're getting a delivery into your household, whether it's food, mail, or something else, take some time to sanitize that item. Consider that item to possibly be contaminated with the virus. A lot of people are doing that. Some people may not be, but I think having that in your mind right now, that every individual could be asymptomatic and could have the virus, could pass it on. Any object that you're handling might have the virus on it. Make sure you're sanitizing the object, washing your hands after you handle it. I think we will get over this hump, and we'll start to see the light at the end of the tunnel.
Well, I want to thank you, Chief. I know you're a busy man with a very busy department at the moment. And Ryan, thank you so much for coming on Talk of the Town. We will get through this. We'll get through this together. We're particularly grateful, obviously, to all the healthcare workers who are on the front line of this. And we certainly, are grateful for their, putting themselves in harm's way so that we can all respond to this really terrible epidemic. So, but thank you so much I'm going to let you guys go back to work, and appreciate you coming on Talk of the Town. And to those who are watching, thank you for watching, and we'll see you next time.